What are some key patient characteristics that you must consider when making therapeutic decisions?
Right, so I guess the first thing that you always have to consider is whether there's any contraindication to a particular therapy for an individual patient. So it could be that someone has had a history of blood clots, or they have problems with sitting upright, so they're not able to take oral medications properly. It could be that they have problems remembering to take their medication regularly, in which case you might favour an intravenous or an injectable treatment. Some people might find it difficult to inject themselves with a medication, either because they've got arthritis or because they just don't like the idea of that. But really, patient choice is really, really key here as well. So when you consider the range of drugs that might be an option for an individual, most people are probably drawn to either taking a tablet or to having an injection. And that is really, really powerful, because we know that adherence and compliance with these medications can be quite low, about 20-30%. So really making sure that the patient has bought into the best choice for them is really important in trying to maximise the chances that they're going to stick with the treatment.
Are there any treatments that patients find particularly easy or difficult to comply with? Should this form part of your decision making?
So I would say yes. So oral bisphosphonates have to be taken in a very specific way. They have to be taken on an empty stomach, sitting upright, and you have to stay upright for half an hour without eating or drinking anything after you've taken the tablet. And that's really important, because otherwise the risk of side effects goes up quite substantially, and people have to take that treatment every week. So as you can imagine, that's quite an ask of someone. And a lot of people, when they hear that, would say, actually, I'm not sure that that's a treatment that I'm going to find easy to take. We do obviously have injections that could be given by a health professional, and most people are quite amenable to the idea of that. Obviously, some people don't like injections, so they may prefer not to go with that. We do have intravenous treatments that require people to come up to the hospital. So some people might say, actually, that's a commitment that's difficult for me. And sometimes, obviously, some treatments require people to self-inject. And for some people, that's fine. But for other patients, they would find that challenging for a whole variety of reasons.
Is anyone ever too young or too old for osteoporosis treatment?
So, you can never be too young or too old for osteoporosis treatment. If you need it, you need it. It's probably less common for a young person to need treatment, because a young person's risk of fracture is typically much lower. The risk goes up as you get older. So it's certainly less common for us to give a young person an osteoporosis treatment. And of course, particularly in young women, we always think about risk of pregnancy and not giving them a medication that might be in their skeleton around the time that they conceive and carry a child. But if you need treatment, you need treatment. So that's, I think, a really important message. As you get older, your risk of fracture goes up quite a lot. So I'd absolutely stress that you can never be too old for treatment. And actually, it's really important that we're not ageist about this. Some older people have got very high fracture risk, and it's really important that they are assessed and treated, because the consequence of osteoporosis fracture can be devastating for morbidity or mortality. So we absolutely treat all ages.